We're going to start with the doctor. He's on a very tight schedule. So is there an overall statement that you'd like to make first?
Sure. So Augusta University is very pleased to partner with the different entities that have sponsored this, the Dougherty County, the Board of Education, the City of Albany, and the Dougherty County School System in order to provide this antibody testing and, most importantly, the study. As you know, Albany and the Albany area and surrounding area were particularly hard hit by COVID-19. And we believe that it's important to understand both what has happened in the community through studies like this, and to add to the information that we know about COVID-19 and how it might affect the community moving forward. Although there's a lot that remains unknown about COVID-19, there's also a lot that we have learned, but studies like this can help to fill in the blanks and add more pieces to the puzzle about our understanding of COVID-19. Most importantly, there have been studies that suggested that antibodies may wane and that they may go away. And this study, and particularly the timing of this study, will be particularly useful about understanding how long those antibodies might persist in those that we have known to have a confirmed infection, as well as in those that perhaps were never diagnosed, yet may still have antibodies to the virus. So Augusta University and the Augusta University Health System are very pleased to partner with the entities that have sponsored this locally. And we're looking forward to finding out a lot of interesting information about COVID-19 in order to assist our understanding and to inform the community about how this disease might affect them moving forward. With that, I'll be glad to take any questions that you may have.
Jamie, you have any questions for the doctor? And then we'll move on to Mr. Fowler.
Okay, can you guys hear me okay?
Yes, ma'am, I can.
Okay. Awesome. So basically, for those that may not know what the process is of being tested for antibodies, how would you describe kind of the step-by-step once they pull up at the Civic Center? What's going to happen?
Sure. So an antibody test is a blood test. So it does require a blood draw. We do ask that individuals call to schedule. We schedule the appointments for the test to make it both efficient and convenient. And also because we have targets by area of the community to make certain that we get a broad representation across the community of individuals participating in the study. We will be testing about 3,200 individuals as part of this study. About 2,000 of those we will be from the Board of Education specifically, and we will be analyzing that data by the different schools and level of schools within the system. And then about 1,200 of those will be individuals from the public, but we would like those evenly distributed across the different zip codes within the community so that we get a broad representation. So we ask individuals to call a phone number. If they're a member of the Board of Education and the school system, we ask them to call this 706-721-9740 phone number in order to schedule their antibody test. And the general public should call 706-721-4905. And I'll give you those two numbers again. The Dougherty school system should call employees, not students, but employees should call 706-721-9740. All other individuals for the general public that wish to participate in this study should call 706-721-4905. We'll schedule those appointments between now and September the 29th. Those individuals would then come to the Albany Civic Center at 100 West Oglethorpe Boulevard in Albany, where the testing is being scheduled. They will have some paperwork that needs to be completed at the time, but we try to keep that to a minimum. And then the individual would be taken into an area where they will have their blood drawn. And after having their blood drawn, then we would ask them to fill out and participate in the study component, which is a survey. And that is a series of questions about their health, about what symptoms they might have had, when those symptoms are, a little bit about where they work and what their exposures have been. And then we combine that information between that antibody result with that survey result. And all the process is very efficient and very smooth. When we've conducted this in other locations, generally it takes about 30 minutes or so for someone to make it through the process, but we try to make it even smoother and more efficient than that.
Not sure who JE is. Do you have any questions?
I know you mentioned that you guys are looking for participants in certain areas. Do you want to explain a little bit about why it's so important that you have representation from different parts of Albany and Dougherty County?
Sure. So we want this study to be representative of the community as a whole. One of the things we know about COVID-19 is that it does not affect all communities equally. For example, we know that Black and African American communities are more heavily impacted and disproportionately impacted by this disease. So we want a representation of the community that represents that, and that is the community. And the easiest way of doing that is by making sure that we get a broad geographic representation across the area. And then, of course, we will analyze that data to make certain that it does represent the community as a whole. So it's important that we get a broad representation of those that are living in the area, and hence one of the reasons that we are making certain that we distribute that out across those areas of the county.
Yes, sir. And where can people access the certain zip codes that, would be best suited for the study?
Sure. So we've already done that analysis, and in our scheduling system, we have it set up to where we track people by the zip code where they reside. And that's when we will perhaps put limits on that to make certain that we leave room for those other areas. So for the individuals that live in those different zip codes, and that being 31701, 31704, 31705, 31707, 31721, we have target numbers established for each of those zip codes. So when people call to schedule their antibody test, then we will automatically track how many people we already have from that area in order to leave space for those that might live in different zip codes in the event that we get a heavier response from a particular one.
Perfect. I think that's all of my questions for you. Thank you so much.
Sure.
Okay, and now we'll go to Mr. Fowler. Mr. Fowler, he named some zip codes that you're very familiar with, and just want to start it off, Jamie, if you don't mind, asking Mr. Fowler just how important it is for those individuals in those zip codes to participate in the testing. Ms. Fowler?
Okay. Hey, Doc, how you doing this morning? Glad to be a part of the panel. I had a couple of questions because I had some family members calling and asking questions about the antibody. From this study, right? There's nothing saying that you have built up the immune against the virus or anything like that, right?
Right. So we do know that it appears that if you have antibodies, that you have some level of immunity against COVID-19. And we don't yet fully understand that, but this study will provide one additional piece of the puzzle to help us understand that. There is growing evidence, however, that if you have antibodies, that you at least have some level of protection, and we believe that you probably have immunity if antibodies are currently present in your blood.
So talking to the Department of Public Health, it'll build up immunity for like maybe 90 days. Could you get the virus when you have immune? I know you say that'll give you some protection. But the public want to know, well, if I got my immune system is built up against this virus, still could I get the virus? If I've had the virus, could I get it again? So
sure, the best evidence right now suggests that people do not get reinfected. That is, what science is complicated, but medicine's even more complicated because of the variability of the human body. But the best evidence right now is that people that have antibodies have some level of immunity. And this study will help us answer how long that immunity might last. As you know, Albany was affected very early on in the pandemic, fairly heavily. And so the timing of this study actually will be very useful for looking at what's occurring in the community right now in terms of the antibody levels. And that will really help to inform the science about this moving forward.
Mr. Fowler, great questions. Knowing the questions that you've had and the feedback that you're getting from the community, why do you feel it's so important? Because he named some zip codes that you're very familiar with. So how do you feel, and how do you think we should encourage, especially those individuals in these zip codes, to participate in the testing? You've been a great face for, COVID-19 and encouraging people to mask up and, encouraging people to get tested. So now we're in this stage. What can you say to encourage those individuals to participate?
Well, I think it's very important to find out have the person been around someone have been with the virus, because definitely if you build some kind of immune system against this virus, it's going to be some kind of form of protection, especially with our Black neighborhood, with the health issues and the problems that we are having. Any kind of protection has been none at all. I know it's a study and different, people in the community are asking questions. How much blood I got to give, is it a stick or not? Things like that. I think it'll be important to know. Then you got some people, I'm just being real. Well, are we just being guinea pigs? But I don't think it's necessarily being a guinea pig. This is a new virus to our community. It's not like TB or some other virus that have been here that we've been dealing with. This is something new that we are studying, trying to find out more and more about it. What can we do to keep from spread, and also what could we do to build up our immune system against this virus, because it may be with us for a long period of time. So I encourage the community to go out and get the test and see what could we do to help our community to move forward. And I think not just for Dougherty County, but for the whole world. This test is very important. And I thank Augusta Medical Center for putting this on.
Okay, thank you, Mr. Fowler. Now, Chief Scott. Jamie, did you have a question for the coroner? I'm sorry.
The only thing that I could think of, and you kind of already touched on this, when you go into these houses and communities, Mr. Fowler, and you're, doing your everyday job, you get to talk to the public a lot. What are kind of I know you mentioned some of their questions, but what's some of the feedback that you're getting as you're out and about in ththese communities? Are they interested in participating in this study? Have you kind of been encouraging them to do so?
Well, I think individuals, they have the question, like I said, you got some, I'm being real, they saying, I'm going to be a guinea pig. Y'all just testing, trying to find out in our neighborhood. I think it's something that they just don't understand. I think by the more we talking about it and explaining it to them, they'll be more aware of what you're talking about, what the process is. A lot of them didn't understand the process of what we got to do, how much blood we got to give. It's a needle stick, and we got to give a tube of blood. They ask all kinds of questions about this. And then once I build up my immune system, is I'm going to be protected. Do I need to keep wearing masks or not? My immune system built up against the virus? Then if I get it, is it going to last for 90 days? Is it going to last for a year? Is it going to protect the rest of my life? So these questions, what the community are asking, what the benefits of the study. And I think it's a great benefit. And by trying to find out, and like I said, new to the community, for the whole world to see more about this virus, because it's new to all of us.
Yes.
And actually, if I could add on in the response to that and answer some of those questions. One, it is a blood draw. It is a needle stick to draw a tube of blood. The benefit to the individual is that they will learn whether or not they have antibodies, and that is the benefit to the individual. Now, people that do have antibodies, we still tell them that they should continue to practice precautions, although there is growing evidence that it provides some immunity and some protection. This study will help us answer the question about perhaps how long that immunity lasts and what those antibody levels are longer term, particularly for people that may have been infected very early on in the pandemic, as Albany was. And hence one of the reasons that the study will provide a lot of information, as Mr. Fowler said, to the world about how this disease affects different communities and how long that immunity may last. So this will help to answer that very important question. And the benefit to the individual is there are a lot of people out there, particularly early on, that could not get a test, couldn't get an antibody test because, a PCR test, because testing was so limited, and have wondered whether or not they actually had this disease. So for many people, it's helpful to know whether or not they have antibodies to confirm what they may suspect that they had the disease, as this may do. I think that's the important benefit to the individual, as well as the fact that they'll be helping the community and potentially inform the rest of the world about how this affects us.
That's good. I appreciate y'all, Doc, again for doing this study. I mean, I know y'all are busy already, but taking time out to do this study to help this world, I think it's a positive thing.
And Chief Scott?
Yes.
You've had the test done. So how was it?
It was relatively painless. It was a great experience. I was in and out of the Civic Center in less than 10 minutes. I mean, it didn't take any time. The team from Augusta University greeted me upon entering the Civic Center. Of course, you have to pre-register, so they had the information. I was in and out. The person drawing the blood, the phlebotomist, was just such a kind person, and it's probably the best blood draw I think I've had. It was just so simple, very nice, and we were in and out. So I just I encourage everyone, please go in and have the antibody testing done. As Dr. Cool has said already, it is so important because it allows you to know your status. Research has just shown that many people who are infected with COVID-19 show no or mild signs and symptoms of the illness. So antibody tests could be useful, in determining if you've had it without knowing it. That's important. I think that is important. Also antibody tests results could also help guide your doctor in making clinical decisions about your care. And then finally, I just like to say too, and again, to reiterate what we've heard, just to understand the disease prevalence. That is so important. And that's what this study is going to do for us. Widespread antibody testing, it gives researchers a better understanding of how many people have been infected and how deadly the virus really is. And that is my case this morning. And I just encourage everyone to call in and be tested.
Chief Scott, one thing that I guess we haven't promoted very well is that the test is free.
It is. It certainly is. It is being given at no charge because of an excellent partnership. And I'm glad that you said that, because this partnership is between Augusta University, the city of Albany, Dougherty County, and the Dougherty County School System have all partnered together to provide the funding necessary to make this happen in our community. This is
really a great opportunity for us to, again, two things: know our status, understand the disease prevalence, free of charge. Please, everyone, take advantage of this opportunity.
Jamie, you have any further questions?
Hey, so I'm not sure who would be best to ask this question to, so I'll just put it out there. But I know with the weather that we've had recently, you know, that probably deterred some people from coming out and participating in the early days. Where do we stand now with numbers? How many more people do we need to reach? And how can we encourage them to come out now that the weather is over?
Sure, I can handle that one. So we've already had 420 out of the 3,200 that we intend to test are already scheduled. So we're off to a great start, but we do have plenty of opportunity for additional people to participate. Of those that are already scheduled, about 272 of those are with the Dougherty County school system, and the remainder are from the general public, with a pretty good representation across the different zip codes that we are targeting to participate in this study. So off to a good start, but plenty of opportunity left for many people to participate in this study. And as was mentioned by Chief Scott, it is free of charge to the individuals participating.
Anything else, Jamie?
Supposed to start on Wednesday. How did the weather kind of impact that? And what are we back up and fully operational now, normal hours? You know, what's kind of the status in the aftermath of all the rain that we had?
Chief, I think you're muted.
Hear me now?
Yes, sir. Go ahead.
Okay. The weather did have an effect on us. We actually had to stop testing a little bit early, but we're back on schedule. And the weather may have stopped us for the afternoon hours just a bit, but we're back up, and it's really beautiful out. We're expecting some nice weather to be in our future. And we want to pick up those numbers and also help us reach our goal. We do have a goal that's set that we're trying to accomplish, and we want to get as many people in as we can in the various zip codes to come out. But we're expecting some really good weather, and again, had a little bit of an effect on us, but we've rebounded from that and we're ready to go.
Awesome. And what are the hours of testing? I know they have to call first and schedule an appointment, but what are the hours that people are there doing testing and being set up?
Yes. Let me just give me
on the flyer, Jamie. You all get the flyer that we sent out?
I will look in my inbox. To be honest with you, I have like 1,100 emails that I haven't like actually gone through yet. So I'm sure it's probably in there.
Yeah, it's also on Facebook, on city Facebook page, the city's website. And yes, we did send the flyer out to all the media outlets. So just the hours of operation should be on those flyers. And if I could, I'll resend it to you so it's fresher in your inbox.
Awesome. Thanks so much. I'm like the only Albany reporter right now. So during the day, I get bogged down with so many emails.
We got you. If I could.
Hey, this is Dr. Cool. I just wanted to answer that question. The hours do vary per day. And the reason that we have done that is one, because they're scheduled, but two, we wanted to offer a variety of times for those that might work day shift, for example. We wanted hours extending into the evening. And for those that might work in the evening, we wanted some early morning hours. So the schedule does vary by day. We can get you that published schedule, but I think more importantly, when people call to schedule the appointment, they'll have a designated time that they would be asked to come that is coordinated with them to make it as convenient as possible.
No, Phyllis, another question. The hard hit area was 31701. Doc, do you encourage most individuals from that area to come because they may not know that they may have the virus or been around someone, exposed to someone? 31701 and 31705, the east side. Do you encourage that? I mean, I think it's important that they come because many of them are most affected in those areas.
Right.
I agree. I think particularly for those areas, it's important for people in those areas to participate. In addition to that, we want to be able to compare those areas that were hardest hit with other areas in the community. And that will help us to, again, to understand how this has affected the community. And as I've said many times, it doesn't affect all communities equally, and helping to understand why that is and having that broad representation from across the community is really vital to the study. So we would encourage everyone to participate, but particularly those that think that they might have been exposed or had the illness, and help us understand how this has impacted them and the community.
How can we get people to overcome, like Mr. Fowler said, overcome that fear of, and really understand what the purpose is? Just let's get away from the fear of it, because I understand Mr. Fowler's point. There is fear in the Black community about the testing. Again, doctor, if you would just what are your words of encouragement for those who may fear taking the test?
Sure, and I appreciate that. And as we know, unfortunately, there is some history that would cause people to have some skepticism. Luckily, because of some of those events, there are significant measures that are taken to ensure privacy. For example, when an individual participates in this study, they will get their results directly to them via the patient portal, is what we call it. So that via an application that will share that result as soon as it is completed back to them in a secure fashion, so that information is protected. But more importantly, when they participate in the study, those are linked by a unique number, so that the study researchers will not actually even know their identity. And there's no way possible for them to be able to link the two. And so we will combine the results of the survey that they complete with those results, and they're linked by a unique number rather than the individual themselves, so that the researchers that are compiling this data and using it and trying to analyze this will only have the information that the individual provides through that survey result without their name attached to it, and will really have no way of linking that back to them in any other way. So that link across those will combine that result with that survey information. So the bottom line is that we actually go to great lengths to make sure that we protect patient privacy, that there's no way that this information could be misused, and that there's a lot of review of this to make certain that we protect people's information and that there's nothing inappropriate that occurs.
That's good to know, Doc, because a lot of family members are concerned about that. And also, many people would not go to the hospital because they say, if I go to the hospital, I'm trying to get the virus. So could you assure them coming out to be tested in the study that you're not going to catch the virus, because everyone's going to be practicing social distancing and safety precaution, because, ain't no sense in me going out there because somebody probably got it and I might go out there and get it. These questions that do come up.
Sure. So let me address that. So one, we are taking all the appropriate measures for social distancing, wearing masks. And one of the reasons that we scheduled these appointments is so that we don't have lines of people, that things are very efficient, and so that people come in, get their test, and are out very quickly, as Chief Scott described. I didn't want to overpromise. I was going to say 15 minutes, but I wanted to say 30 so that I didn't create an unreasonable expectation. But the reality is most people are in and out very quickly. with little to no exposure to other individuals because of all of the measures that we're taking. The other thing is that, of course, when we are paying attention to those, that it is safe to get health care. A CDC study suggested that 4 out of 10 individuals had delayed health care. And the reality is that there is not a reason to delay health care because of COVID concerns. The reality is that in the hospital, all of the measures that we're taking to control this are effective. And we see almost absolutely no transmission between healthcare providers and patients, or even between patients. So we can assure the public that it is safe to get this testing done, and that we're taking all the appropriate measures to make sure that this doesn't become a source of infection for anyone.
Doctor, your time
Right.
is we appreciate you investing your time this morning with us. But Jamie, if you don't have anything further, we're gonna wrap everything up.
Yeah,
Thank
no,
you very much for having me, and thank you for allowing us to participate in this important study.
Thank you, sir.
Yeah, I don't think I have anything else. Just clarifying question. I want to make sure I get these numbers right. You were talking about the overall goal of how many tests need to be done. You talked about how many have already been done. Can you explain just a little bit for people that may not understand, like the numbers with the school system versus the numbers with the public? Just kind of go into depth about that, because I think that's important. Because they're like, oh, we already have 484 participants, but really, you know, that's not an accurate representation. So if you could just break that down, and then I think I'm all done.
Sure. So in this study, we have 2 groups that we're looking at: the Board of Education or school system personnel, as well as the general public. And in order to get a broad representation, we need to look at those groups separately to make sure that we're getting a good broad representation of the community. To date, we have scheduled 272 with the school system, and the remainder of those out of the 420 total that have been scheduled so far. So that's 420 total. Of those, 272 are from the school system. The remainder is the general public. So the targets there are 2,000 from the school system, with the remaining 1,200 from the general public. And so we have very few participants out of the 1,200 from the general public. So there's plenty of appointments left for people to participate in this study, and we would encourage them to do so.
Thank you.
All righty, gentlemen, have a great day.
Thank you.
Thank you.
Bye-bye.
Appreciate it.
Everyone.
Thank you.
Bye. Oh boy.
Thank you, Jonathan.